Well, hi everyone. Thank you so much for joining me today. My name is Macy Lee, and I'm the manager of science and programs for Curves. Before we get started, if you haven't done so already, go grab a tennis ball or lacrosse ball because we are going to do an exercise in just a few minutes. So I'm going to give everyone a few moments to go ahead and go get that tennis ball and lacrosse ball, and we will get started in just about a minute. All right, well, we're ready to get started. I hope you guys are ready for this. I am super excited for this topic today. But before we jump in, I do have a few questions to ask you, and you can either unmute or type it in the chat. I'd always love to know. But over the past few months, have you noticed that you have tight or sore muscles? Seeing some yeses pop in. Awesome. You ever notice that you maybe have limited range of motion in your joints? Maybe you can't move as much as you used to be able to, or as much as the other side. All right, so more yeses. Well, then you're in the right place today. As we go through today's presentation, if you have any questions, please feel free to drop them into the chat. I will be checking that periodically, and then I will do question and answer at the end. So exciting. This month on My Curves on Demand, we are introducing a new category called Stretching and Recovery. And this category contains classes that are primarily focused on post workout recovery, such as stretching only classes. But this is also where you will find our newest classes, little drum roll, foam rolling. So, what exactly is foam rolling and why do we want to be doing it? Well, those are the questions I hope to answer today. Foam rolling is a form of self myofascial release, also known as SMR, or a self delivered deep tissue massage. The purpose of this is to locate knots and tight spots within your muscles that may be impeding your range of motion or muscle performance, and then release these knots and tight spots to allow your muscles to perform better. Though foam rolling has gained popularity over the past 20 years, the first handheld foam rolling device, or actually rolling device, it wasn't even foam, was issued a US patent in the early 1900s. So this is not a new science or a new thing. Massage therapists had found that when their clients used a roller in between massages, they reported feeling better and they were able to hold on to the results of the massage longer. However, that being said, most people don't perform foam rolling the way it is research has recommended. This involves identifying tight spots within the muscles and applying specific techniques to change the tissue. The theory of foam rolling is that it can have that similar effect, as I mentioned before, as a deep tissue massage by applying compression and encouraging circulation. In these foam rolling classes, you're going to learn how to use a foam roller to apply pressure to these knots and sore spots. We will start with superficial muscles and gradually work into deeper tissue for the greatest benefit. And when done correctly, foam rolling can have that similar effect of massage by increasing circulation, releasing scar tissue, and it can help realign your joints to improve movement in that area. This is accomplished by applying compression. Over the past several years, a number of research studies have been conducted highlighting the benefits of foam rolling. Benefits included decreased soreness and fatigue following a workout, improved muscle function and range of motion, improved artery flexibility, which can lower your blood pressure because the body is able to push blood easily through the body with greater ease. So, in short, foam rolling can be like hitting the reboot button on your body. Sound good so far? I will say this, as with every new exercise program, it's always best to consult your primary care provider first, especially if you have any chronic pain or any major injuries. With all of the benefits of foam rolling, it's hard to believe that there may be some reasons not to foam roll. And I want to quickly go over what some of these reasons may be because they may or may not apply to you. Osteoporosis, it's preferred that you avoid rolling on your spine and on your hips. You can still use that on your thigh muscles and on your chest muscles, but you just want to avoid the spine and the hips due to an increased risk of fracture. Diabetes, particularly if you have neuropathy, you want to avoid foam rolling in that area you have neuropathy because foam rolling can cause damage to the blood vessels and you may not feel it. High blood pressure. Foam rolling, when done correctly, is uncomfortable. And any discomfort can cause you to hold your breath, excuse me, which can elevate your blood pressure. Varicose veins. Foam rolling over varicose veins can cause more damage to the vein as well as increased discomfort. So you can still foam roll, you just want to avoid the areas that you have varicose veins in. Any area where you've had a recent injury or surgery should be avoided. And then here's another interesting one, pregnancy. Foam rolling within the third trimester. This is when your body produces a hormone called relaxin, which helps the muscles around the hips relax in preparation for giving birth. Foam rolling in this area can cause greater instability to the hips. It's also said that pregnant women should avoid foam rolling their lower legs, ankles, and feet because this can induce labor unless that's the result you're looking for. As I mentioned before, foam rolling and other forms of myofascial release can cause discomfort, much like a deep tissue massage. So if we think of a scale of 1 to 10, 1 being you feel absolutely nothing, and 10 being extreme discomfort, foam rolling should be somewhere between a 6 and an 8. It's important to note, though, there's a difference between discomfort and pain. If you're feeling pain, which is something sharp and acute, you want to consult your primary care provider. Discomfort should be something that resolves when you stop the activity. Foam rolling can be used either as a warm-up before your workout or as a cool down after you stretch. This chart will help determine if foam rolling is right for you today. There's a few questions you want to ask yourself anytime you're getting ready to do foam rolling. 1, am I sore today? If the answer is no, you may not need to foam roll. But if the answer is yes, foam rolling may help you out. 2, do I have limited range of motion? If you have any stiffness or limited range of motion, again, foam rolling may help you out. But remember, it's important to start with the superficial muscles and then gradually work deeper. Body symmetry is also really important when we foam roll. Our muscles are all connected through the kinetic chain, so it's important that we spend 20 to 30 seconds on each muscle, both right and left. We want to roll at about 1 centimeter per second. When you find an area of tightness or a knot, you simply want to pause and apply pressure to that area for 20 to 30 seconds before moving on to the next area. And as stated before, the purpose of foam rolling is to release tight muscles. To do this, we're going to focus on one muscle group at a time and then slowly work to the others. So as I mentioned before, our body is all connected through the kinetic chain. So I want us to all get up and do an exercise. I hope you have your tennis ball. We're going to start by doing a stretch. So I'm going to have everyone stand up. I'm going to stand up and do it with you, so pardon me here. And we're going to do just a stretch, reach over, and see how far you can touch. Lowering your hands to the ground. How far can you reach? Mid-thigh, your knees, your shins, ankles, tops of your feet. Can you get your hands flat on the floor? Notate how far you were able to reach because we'll repeat this test at the end of this. Okay, so how far were you able to reach your hands down? Could you get your hands to your thighs or knees, your shins, your ankles, maybe your feet, or even to the floor? And I want you to notate when you do that, any tightness you may be feeling. Where are some muscles that may be tight or sore? And now, sitting in our chair, we're going to utilize our tennis ball. We're going to place it underneath our feet. And we're going to do a little foam rolling on our feet. So I'm going to go ahead. We're going to get that ball down on the floor. We're going to start this video. So, oh, sorry. Let me go back here. We're just going to simply start at our heel and slowly roll forward. I'm going to use more of my hand than my foot because you wouldn't be able to see my feet. Slowly roll forward on the foot until you find a tight spot and then just apply gentle pressure. And then continue to slowly roll. Again, we're rolling at about 1 centimeter per second, so it's really slow. And then when we apply pressure, we're going to take some deep breaths and hold it for 10 to 15 seconds before we continue to roll forward towards our toes. So really take your time with this. Okay, now let's try the other foot. We're going to do the same thing. Start at the heel, and we're just going to slowly roll forward till we find a tight spot. Apply some gentle pressure, some nice deep breaths. And again, continue to roll nice and slow, working your way towards your toes. If you find another tight spot, again, nice deep breath, applying some pressure. Slowly working your way towards your toes. Great. Now, before we get up, I'd love to know if anyone felt any tight spots in their feet. I did this one earlier today and it felt fantastic. So go ahead, you can unmute or type in the chat. Would love to know what you guys were feeling. Oh, good. Seeing some people that were finding some sore spots in their feet, hopefully now feeling better. Now, as I mentioned before, our body is all connected through a kinetic chain. What happens in our feet actually does affect our lower back, our upper back, and into our shoulders. So we're going to repeat that stretch. I'm going to have everyone stand up again. We're going to reach our hands up overhead and then hinge forward. And now I want you to pay attention to how far you can reach. So let's go ahead and do that. Let's do a little test. I want you to hinge forward at the hips, lowering your hands to the ground. How far can you reach? Mid-thigh, your knees, your shins, ankles, tops of your feet. Can you get your hands flat on the floor? Notate how far you were able to reach because we'll repeat this test at the end of this class. Okay, so, oh my gosh, someone just told me they gained 3 inches. That's what I was going to ask. What was the difference? What was the difference? Jean says that when she was rolling, it felt warm and felt loose. That is awesome to hear, but I would love to know what differences between the first time you did it and what you just did now. This is so exciting. Really just goes to show something we took 2 minutes to do has a huge impact on our body. So just think about if we were to have taken 15 minutes and worked on our calves, on our hamstrings, and on our hips too, how much better we'd feel. Oh, Kathy says definitely was able to reach further. That's so exciting. That's great. So to get the most out of these classes, we want to make sure that you have the Curves foam roller. And I'm going to give you a few reasons why. One, they're made in the USA. They're nice and compact. They're not very big, so they're not going to be bulky for storage, only 18 inches by 6 by 6. They're lightweight, 11 ounces, but they're durable. They can hold over 2,000 pounds. And this is the most important part to me. It's an ideal shape that contours to fit your body and target your muscles and avoid bones and tendons. So you see how it's got those ridges to it. It's really designed so that your bone would slide right between and you would really hit those muscles. So I hope you have found today informative. I hope you have found it exciting to see how just a little bit of foam rolling can make an improvement. And again, think about if we were to have done our whole lower body. If you're a member at a local club, talk to your Curves coach about getting your foam roller. And if you're a member of My Curves on Demand, you can log on to My Curves on Demand and then go to the shopping category. Again, thank you so much for joining me today and learning about our new foam rolling classes. I would love to answer any questions anyone has. You can put them in the chat or simply unmute. What will the classes on My Curves on Demand look like? They look like a lot like our other My Curves on Demand classes. We do a foam roll stretch, roll my area for 30 to 40 seconds, and then there's a change stations, and then we repeat it on the other side. and so forth. And just so you guys know, those classes are already up and live on My Curves on Demand, so feel free to go check them out. Just make sure you've got your foam roller. Any other questions? Well, thanks all. Appreciate everyone being here. I hope you have an awesome day, and I look forward to seeing you all real soon.